Hi, I'm Dr. Evelyn White. I practice internal medicine at the NCH Medical Group, and I've been in practice since 1999. I decided to become a doctor for several reasons. I grew up in a family of doctors. My father was a neurosurgeon, my mother is a retired pathologist, and my grandfather was a general practitioner on the northwest side of Chicago. I also really enjoy the sciences and applying scientific knowledge to caring for patients. I chose internal medicine because I enjoy treating various medical conditions. I also believe strongly in preventive care. I believe it is very important in trying to detect illness early, to prevent illness, or detect them in an early state where they're much more treatable. I also like to establish long-term relationships with my patients. I treat patients 14 years and up. I treat conditions ranging from upper respiratory infections and back pain to more complex conditions such as diabetes, hypertension, COPD. I do general physicals for preventive care reasons. I also do immigration physicals for people applying for their green cards. I strongly believe in preventive care, and I do have a special interest in treating high cholesterol or hyperlipidemia. I would describe my practice philosophy as being very thorough. I believe in aggressively treating conditions such as diabetes, hypertension, hyperlipidemia. However, I'm willing to work with the patient. I take each patient's situation into account when ordering tests and treating the patient. A good doctor-patient relationship involves open communication. I try very hard to thoroughly explain patients' medical conditions to them and any testing or treatment that I recommend. I do ask that if a patient has a question or concern regarding their treatment or testing, that they contact me to further discuss that. Patients would describe my bedside manner as approachable, caring, friendly. I take the time to explain their medical conditions and any testing or treatment that I recommend. I believe strongly in educating the patient on their medical conditions, as that is a very integral part of their care. During their first visit with me, a patient can expect it to be a visit where I get to know them. I review any old records that they may bring from a previous physician. I take a thorough history and address any current problems that they may have at that time. And do a full physical exam, and then order any blood or other testing that is appropriate for their condition at the time, and then recommend any appropriate follow-up. What I find most rewarding about being a doctor is when a patient feels better, either recovering from an acute medical illness or when a chronic condition is better controlled. In my free time, I spend it mainly with my family. I have 2 young children, so they keep me very busy. We like to do various things on the weekend, try to spend time as much as we can outdoors, try to get into the city when we can. My husband and I like to cook. We're part of a dinner group in our neighborhood. We also like to travel when we can.